For changing the torque line, apical line, and file rotation speed, use the mode switch to select M1, M2, or M3. Use the select switch to select the item you want to change. Once the item starts flashing, press the set switch to change the setup. The setup is saved when the item stops flashing. All memory settings will be retained even after the unit is turned off. Other setups, such as alarm sound volume, can be changed by doing the following. Turn off the unit. Press the select switch and turn the power back on without releasing the select switch. Release the select switch and press the mode switch to select M1, M2, or M3. Press the select switch to select the item you want to change. Once the item starts flashing, press the set switch to change the setup. The setup is saved when the item stops flashing. Once again, all memory settings will be retained even after the unit is turned off. Use the manual mode for rotating the file outside the root canal. Set up file rotation speed by pressing the mode switch or the select switch. Then press the mode switch while holding down the set switch. The auto symbol on the LCD screen changes to manual and the motor starts rotating. Press the set switch to stop the rotation. Root canal measurement can be done with the canal measurement module alone, as well as with the low-speed handpiece module connected to the canal measurement module. With the canal measurement module alone, insert the probe cord into the jack of the canal measurement module. Then attach the file holder to the gray connector and the contrary electrode to the probe connector. Attach the hand file to the file holder to start measuring the root canal. There are two methods available for the canal measurement using the low-speed handpiece module connected to the canal measurement module. First, leave the micromotor connected to the unit and press the mode switch until speed and memory displays disappear. Under this condition, the file will not rotate when it is inserted into the root canal, and only canal measurement will be performed. Make sure the speed does not appear on the display. The file will rotate if speed is shown on the display. Secondly, detach the micromotor from the handpiece cord. The unit automatically goes to the canal measurement mode. In this mode, follow the same instructions as previously mentioned when using the canal measurement module alone. When measuring the root canal, make sure the file electrode does not come into contact with an electric power source such as an electric socket. This could result in a severe electrical shock. The position of the file tip is shown by the canal length indicator bar on the display. The preset apical line flashes once the file is inserted into the canal. The indicator bar's 0.5 reading indicates that the file tip is in the apical constriction. As the file is advanced toward the preset apical line, a beeping sound indicates the position of the file tip. If the file tip passes the point indicated by the apical line, the alarm sound will change from beeping to a solid tone. Occasionally, the canal length indicator bar makes a sudden and large movement as soon as the file is inserted into the canal, but it will return to normal as the file is advanced towards the apex. Before using the micromotor, use a small file such as number 10 or number 15 to penetrate the root canal manually down to the apex. Hook the contrary electrode in the corner of the patient's mouth. The file will automatically start to rotate when it is inserted into the root canal. If the auto start function does not operate, it is due to the root canal being dry. Moisten the root canal with a liquid such as hydrogen peroxide, sodium hypochlorite, or saline solution. Do not let liquid overflow from the root canal opening. Using large files to small files, shape the root canal from the coronal portion toward the apex with the crown down technique. Once the file tip reaches the preset point, finish shaping the root canal with a large file. Following the auto torque reverse function, advance the file slowly without applying excessive force using a picking motion. The file will stop rotating when it reaches the preset point with a beeping sound and starts reverse rotation. The file will stop rotating when it is removed from the root canal. Gradually increase the size of the file until the root canal preparation is completed. The contra angle, file holder, contrary electrode, and handpiece rest can be autoclaved under the temperature of 135 degrees Celsius or 275 degrees Fahrenheit. Thoroughly clean and wash the components before autoclaving. The micromotor, handpiece cord, and probe cord cannot be autoclaved. Wipe these components with a piece of gauze dampened with ethanol. To clean the Root ZX2 modules, AC adapter, and foot switch, use a soft cloth with a neutral detergent and then rinse it with a cloth dampened in water. Before autoclaving the contra angle, wipe it with a piece of gauze dampened with ethanol. Put the contra angle in a sterilization pouch and autoclave it. An accurate measurement cannot be made if the file electrode is worn down by prolonged use. Replace it about every 6 months if it shows damage or excessive wear. Remove the file electrode's retaining screw. Pull the old file electrode straight out and replace it with the new one. Replace the screw and tighten it. Check that the new file electrode properly clips onto a file. The unit should be inspected every 6 months in accordance with the maintenance and inspection items in the instruction manual. The Root ZX2 combines precise canal measurement with a number of automatic operation features for smooth root canal preparation. This concludes our instructional video. Thank you for your attention.